Sunday at NHS Hack Day, people are starting to have their lunch. I am just catching up and having a quick conversation with Sara Dada, who is here today, been working on I don't know that much about your project, all I know it's a data project. So First of all, tell me about you, Sara. Where have you come from?
So I am from the States, originally from Atlanta, but I'm actually currently studying in London at the Royal Veterinary College in a Master's of One Health and Infectious Diseases. So kind of a clinical biological understanding of infectious diseases, but also the social sciences aspect of control programs and interventions and things like that. So my background is in public policy, but I've kind of dove right into this biological major or degree program at RVC.
Fantastic.
And now trying to branch out and kind of see other aspects of healthcare.
So how did you hear about NHS Hack Day?
A friend of mine, actually, who's also here, sent it to me, also in the same scholarship program that brought us both to London. And so just tagged along, thought it would be a cool experience.
Yeah, and how have you found it? Have you ever been to a hackathon or anything like that before?
I actually haven't. This is a very different experience for me, really out of my comfort zone, but it's been really, really cool to learn about all the work that's being done and the different potential and opportunities for improvement.
Yeah. So how did you find the whole experience of picking a project and working on it? What was that like?
It was pretty overwhelming. I found myself not really understanding a lot of the technical details and aspects, but
at the start, whenever people were pitching things, it was hard to understand what people were. And then how did you have a chance to talk to the people
so it was great to be able to walk around and to talk to people a little more in depth, and I think the part that was most interesting was kind of finding connections and linkages between what they're looking for, some of the problems that people presented or the ideas they had, and then what I've done and any experiences that I have, and if there could be a link. So for example, the way I ended up finding the projects that I'm in was it started with a conversation about risk pathways, which was something I recently did in my master's course on risk assessments, and so that just kind of spiraled into a conversation of what can we do about different risk factors and potential either infectious diseases or non-communicable diseases in the UK, and how can we use that to kind of find an interesting solution or insight to the problem.
And what's the main thing you've kind of learned over the weekend? I know that's a hard question.
I've learned, the first thing that comes to mind is I've learned about a lot of differences in unit conversions in a UK billion being different than a US billion.
Oh, really?
So I spent a little bit of time trying to convert some monetary amounts to determine how much money was being spent on asthma in the UK.
That's fantastic. Yeah.
Yeah, that's a silly thing, but.
So you've been doing that, you've been working on data then, and that is related to what you do. I mean, have you been doing different things to what you would normally?
A little bit. It's been, I've kind of tried to relate it through the lens of what I'm familiar with and what I've done, which has been a lot of, we did some disease modeling a few weeks ago. So first looked into that to see if we could maybe model how these different factors like traffic or pollution or air quality or weather impact respiratory illness, specifically asthma. But then when that was kind of not working out in that model format, we started looking at maybe mapping it and geospatial analysis of it, which is something that I haven't actually done in my course, but is definitely relevant to infectious diseases and what my interests are long term.
And just thinking, if you were talking to somebody that was thinking about coming to an NHS Hack Day, what advice would you give them?
That's a great question. Well, definitely not to be afraid and think that you're not qualified or prepared to come, because I definitely didn't think that I was, but it's still really easy to jump in and just not be afraid to ask questions and to admit when you don't know something. I think that's been the most important thing, has been having people maybe pause and explain something very technical that they just said, because you can make a lot more progress that way.
Yeah, and that's of course a good thing that for all of us to know to do, be able to do all the time whenever we're working, isn't it? So it's going to be able to practice it in a kind of safe space.
Yeah, definitely. Yeah, no, it's definitely a really safe space, which is great.
Oh, that's great. Well, thank you very much, Sara, for coming along. It's lovely to have you here, and really look forward to seeing your presentation and seeing what you've been up to.
Thanks. It's been great.
You're welcome.